tackle chapter 2 and chapter 3. So let's see where that goes. What's up, gangstas? It's from a really funny movie, and I don't remember the title. So anyway, that's McLovin right there. Ways of understanding and perceiving selves, perceiving self and others. So let's go ahead and get started. There we go. Practitioners must realize that each person constructs reality in their own unique way. This is called constructivism. Constructivism focuses on how individuals describe their experiences in terms of personal constructs. You guys construct your world in a select way. I construct my world in a select way, and they're nowhere close to each other. The reality is they are nowhere close to each other. A personal construct is an explanation of an event or series of events that becomes the lens through which the individual sees the world. These constructs are developed as individuals interpret and give meaning to their experiences. Constructs are not consciously developed. They are just developed from your experiences. So if you have lived a traumatic life, then that is the way you see the world. If you haven't been seen any trauma in your life, then you don't see trauma as a possibility because it's never happened to you before. So it all depends on what you've experienced. Social constructivists focus on how relationships, language, and context influence an individual's or a group's interpretation of self, others, and the world. And I have no idea why I put a picture of French soldiers putting something together in World War II or World War I, but that's what I did. I have no idea what my purpose was. Personality is the individual's distinctive qualities, their traits, their characteristics, their behavior patterns. Personality is a socially constructed idea. So if there was no society, we would have no personalities. We would all be the same, and we wouldn't have all of these different facial features, potentially. We would never project ourselves that way. Kind of like, dogs, I guess, or cows. Cows don't have very much of a personality. Well, some of them do, but I guess up in Montana, they have what do they call them? Fence busters, cows that are always trying to get through the fence, and those are always the ones that they butcher first. Some of our strongest personality constructs are developed in childhood. These constructs tend to be harder to change because they're based on immature feelings and possibly illogical thoughts and are established by the undeveloped mind as truths. And of course, this is one of the reasons why dealing with somebody's past is a good idea. It's a good idea in that sometimes they are reacting in immature ways because of immature thoughts they had when these constructs were developed. So what you have to do is talk about the trauma, talk about these times, and look at them from the point of view of an adult. Look, you're an adult now. You don't have to respond this way to your mother. You know, your mother's 92 years old. There's no reason why you should worry about her coming in and beating you with a stick. She's not going to do that. You're 55 years old, and that's not going to happen anymore. But you're still reacting as if that's what's happening, or if that is a potentiality. And of course, that was a potentiality when you were a child. But now that you are an adult, you need to see this from a more realistic point of view. Yes, it was a tragedy when it happened, but there's no reason to fear it anymore. Childhood carryover. Mother, my child is intelligent, handsome, and funny. The child, that is true, if that's what the mother says. Father, he is too awkward to play sports. Son, that's true, I am bad at sports. Mother, no one will love you unless you are thin and beautiful. Daughter, true, I must lose weight and wear lots of makeup to cover my many flaws. Parents, people not like us can't be trusted. Children, true, people who are different are dangerous. Parents, you are worthless and will never amount to anything. Children, true, why even try? So I might as well allow my hair to grow in dreadlocks and collect dogs for a living and be homeless. I'm worthless. Culture strongly influences words used to describe someone's personality. Minority cultures will sometimes accept the dominant culture's view of themselves as true and use that definition to evaluate themselves, which always irritates me. People living down to their stereotypes. Dominant culture, whatever that dominant culture is, will always try to denigrate people that aren't like them, and that happens with all ethnic minorities, not just indigenous people, but also it also happens with African Americans, Hispanics, and whatnot. And it just irritates me to no end when people live down to their stereotypes. Um, if the stereotype is that all African Americans are criminals, a male that's acting like a criminal just really bugs me. It bugs me because they're allowing the dominant culture to tell them how to act. Same thing with the crawling drunk and the drinks like a fish shirts. Yeah, those things really bug me, and that shouldn't happen. Don't live down to your stereotypes. That's why I try not to be greedy. That's a stereotype for us Billigana. We're greedy. The constructivist perspective helps practitioners remember that their view of the world may be different from the client's view. The practitioner needs to remember to work within the client's view of reality. This is a picture of the people that were in Jersey Shore. There's the situation. I think that's what he was called, Snooky. Those are the. One of them was J-pop or something. I don't remember. Anyway, I don't remember any of them. I didn't actually watch the show, but the situation has been out there, and Snooky keeps losing weight and gaining weight and losing weight and gaining weight. When an individual, family, or group becomes aware of a construct that is unsatisfying or limiting, the individual can develop another meaning for events or experiences and begin to realize change is possible. But the idea is better if it comes from the client. The client needs to say, I can change. I don't have to be like I was when I was a kid. I don't have to be like my parents said that we were like when we were children. I can be different. I can get a job and I can change things. I can become I can become president of the United States. I don't have to live in a trailer and whatnot. Of course, sometimes a practitioner will have to work with pair bond structures that have very different individual constructs. A husband may believe that a wife should stay home and raise the children, while his wife might think that she should be able to go out and work. And this was I know this is an anachronism. This is arcane. This comes from the 60s and 70s. But when I first started in psychology, this was the argument. This was the family argument. Men wanted their wives to stay home and raise the children, and women wanted to go out and work. And this was the biggest argument that was going on in the 60s, 70s, and 80s. Should a woman stay home and raise the children? Now, of course, most families are two-income families. They can't afford not to be two-income families. Systems theory takes into account the entire system with which an individual interacts. A system is seen as a complex entity within which interactions are as important as the individuals. Rules are established by the family to teach what is expected or permitted by individual family members. The rules help regulate and stabilize how families function as a unit. Changing one part of the family system will result in changes to other parts. If something in the family dynamic changes, like a wife getting a job to help with the family finances, the homework distribution will have to change to even out the labor. Otherwise, she's working two full-time jobs, and dad's sitting on his butt while he works his 8 hours, and then he goes home and drinks beer and sits on the couch, and that just doesn't work. That's potentially not going to work. So the family dynamic has to change. Family systems may be open or closed to various degrees. In a closed family system, the family exists in relative isolation, with communication taking place primarily between members. Changes avoided, members hold on to established traditions and values. Characteristics of open family systems: willingness to assimilate new information and to engage in ongoing interactions with their environment. The family has no single correct way of doing things. As the family matures, changes are tolerated, supported, and celebrated, like someone has decided that they are gay, or someone has decided that they would like to become the opposite sex. All of these things. In an open family, that is tolerated. In a closed family, that is rejected. In the family systems perspective, practitioners gain an understanding of how interactions within the family system affects clients. Family systems assist clients in identifying reciprocal relationships between their behavior and influences of the system within which they interact. Clients realize both how someone else's behavior is influencing them and how their behavior is influencing others. The ecological perspective views people and their environment as continuously evolving. The ecological perspective is less concerned with cause and effect and more concerned with the transactions that occur between people and their environments. The ecological perspective was derived from the concepts of biological ecology. This structure enables practitioners and clients to think about the reciprocal relationship between people and the environment. And you can see this is in Japan. This is how crowded Japan is. What a mess. Look at all the people wandering back and forth. And it's a road. There's a bus. There's another bus. This is a road. So these are people crossing the road en masse. Ecological perspective has three important components: person-environment fit. Person-environment fit refers to how well a person's needs, goals, and rights mesh with the social and physical environment. A good example of this would be, I'm a ruralist. I grew up on a farm, and now I live in rural Iowa. So the person-environment fit is pretty good here, as far as I'm concerned. My wife was raised on a military base, and a little bit more crowded. She's used to seeing a lot more people than I am, and so the person-environment fit isn't as good for her as it is for me. Adaptations are the processes people use to sustain or increase a level of fit between themselves and the environment. And what she has done, she's joined several groups in this small town that we live near. We don't live in the town, and that's how she has adapted to fit in more to fit in better with her environment. Life stressors are issues that exceed the resources of an individual to deal with them. In the ecological perspective, behaviors are not seen as dysfunctional or maladaptive. Instead, behavior is viewed as adaptations to improve the fit between the individual and the environment. And we do whatever we can to survive. Recently, the gas prices have just expanded amazingly. It's gone up for a couple dollars per gallon in not very a long period of time. So the way people will adapt to that is that they won't drive as much. If they do have more than one vehicle, they'll drive the vehicle that gets the best mileage. They'll try to pack as many people into a small car as they possibly can. They're trying to adapt to the situation. And now that the gas prices are going down, I imagine they're getting back in their dualies and SUVs that get 15 to 20 miles per gallon because they can afford to drive them now. The strengths perspective views all people as having strengths. It focuses on assets clients have developed throughout their lives. A strength is defined as any psychological process that enables a person to think and act in order to benefit himself or herself and society. Strengths are often developed when people struggle with difficulties, traumas, oppression, disappointments, and adversity. And so this has a lot to do with resilience. Resilience is a little bit different because resilience just means you survived, but strengths mean that you have developed new ways of adapting, new ways of looking at things. Everyone has the capacity to develop new resources, to make positive changes, and to use his or her competencies to solve problems. So potentially one of your problems is that you're overweight, and now your doctor tells you that you're pre-diabetic, and what you need to do is change your diet, and you need to exercise more. And so as one of your strengths is the fact that you have decided to do that. One of the things that has happened to me in the recent past, about the last 3 or 4 months, I decided that I was going to stop drinking pop with sugar in it. I was going to try to flatten my stomach out. I was getting too much of a pot belly, and I didn't like the way it looked. So what has happened over the last 2 or 3 months? I have given up. I've given up Code Red, which hasn't been easy because I really like the flavor. I really like the cherry flavor. But I've done it. I have given it up, and if I drink pop, I drink diet pop or zero sugar pop. Right now, I have a zero sugar Mountain Dew in front of me. They also make zero sugar Code Red, so I have some downstairs. Doesn't taste as good as the sugared type, but hey, at least you can get a little bit of a taste of cherry in there. Anyway, that's what I have decided to do. So people had these capacities to change, to do what needs to be done. I also need to increase my exercise level. If I really want a flat stomach, I need to start doing exercises that stress my stomach. So if I really want a flat stomach, if I want to develop my 3-pack, I have a scar that runs across part of my stomach muscles, and it kind of precludes me from having a 6-pack. But I can get 3 on one side, but the other side's all scarred. Not that that's important. Strengths perspective invites clients to discover, think about, and figure out how to use their strengths. This is different from traditional counseling because they tend to identify deficits, weaknesses, and problems. So in the strengths perspective, you're trying to identify how they can, or how the strengths that they have to adapt to whatever the situation is. We're not trying to identify deficits. We're not trying to identify weaknesses. We're not trying to identify problems. When working with individuals, families, groups, or organizations, the practitioner looks for their strengths, identifies their resources, and invites them to focus on possibilities for the future. Resilience is the ability to survive and thrive in the face of overwhelming life challenges. Resilience is a dynamic process that is the outcome of positive adaptation in the face of adversity, stress, or risk. It does take strengths, but at the same time, all we're looking for is survivability. Resilience is not a fixed personality trait or an inborn characteristic. No one is either vulnerable or resilient all the time. Resilience is learned behavior and patterns of adaptation. Resilience depends on the availability of protective factors. Risk factors are any influencing factors that can bring or predict negative outcomes on the functioning and overall development of the individuals. They can include biological influences, individual influences, family influences, and community influences. Curiously enough, I wrote my dissertation on the resilience of an indigenous group in Montana. My idea was, and this is how foolish I am, I thought that what I wanted to do was show something positive about the group rather than talking about the child abuse and talking about the alcoholism and the drug abuse and the domestic violence that was taking place. And like almost everybody else was doing, I decided I wanted to say something nice. I wanted to say something positive about this group because I found them to be really nice people. So I figured that I would do that. The problem was that they were afraid that their resilience level wasn't very high, and that's not the way it turned out. Of course, they had a very high resilience level, higher than just about anybody that had ever been tested. Um, and their strengths. One of the reasons that they had such a high resilience level was because they adhered to their culture, and that's what we discovered. Protective factors are any factors that can exert either direct or indirect influences to buffer the negative effects of risk factors. Protective factors include strengths, capabilities, talents, coping skills, resources, and assets. Resilience represents both a process and the outcome of competent functioning. Resilience as an outcome involves the interplay of risk and protective factors. Resilience as an outcome represents the resultant positive functioning and competence developed when facing adversity. Practitioners using the resilience perspective start with an assessment of the relevant factors and then focus on helping clients build on the resilience that they have developed. Can't remember why I put those in here. Practitioners focus on helping clients. They develop a positive outlook on life and self-confidence. They maintain, promote, and enhance protective factors. They recall successful events in their lives. They identify resources. They view a mistake as a window of learning. They focus on the present and the future. A lot of positive psychology going on here. This is great. Okay, so we're done with resilience. Let's look at the empowerment perspective. Empowerment describes the process by which individuals, groups, and/or communities take control of their circumstances to achieve their goals. A lot of times we are letting other people control the situation, but empowerment means that I take control or we take control of our own situation. Empowerment has an internal as well as an external component. The internal component of empowerment is also called psychological empowerment, control over motivations, cognitions, and personalities. Personality. A lot of times people think negatively, and one of the internal component of empowerment is maintaining a positive attitude toward the outcome. Internal empowerment involves the belief that the individual will make component decisions, solve their problems, achieve their goals, and have a significant impact on their environment. The external component of empowerment includes the tangible knowledge, competencies, skills, information, opportunities, and resources that allow the person to take action and actively advocate change. Empowerment, like resilience, is a process as well as an outcome. New competencies learned from experience leads to new feelings of empowerment. Research shows that the more involved an individual, the stronger the feeling of empowerment. The empowerment perspective allows clients to develop a sense of power and competency as they experience their skills and knowledge in new and challenging ways. The empowerment perspective helps people discover their strengths, identify their goals, and develop a plan to reach their goals, allowing clients to accept responsibility for change and experience a greater sense of empowerment. Okay, so that's the empowerment perspective. The dual perspective views an individual as interacting and adapting to two surrounding systems or environments. The nurturing environment is composed of family, friends, and close associates at school or work. The sustaining environment consists of the people encountered in the wider community and broader society. While most European Americans experience nurturing and sustaining environments as fitting together, other ethnic and racial groups experience a poor fit between them. Individuals in the non-dominant group constantly evaluate disappointments in life to determine whether they are based on one's qualifications or on racism from the dominant culture. Minority members must develop a dual perspective, equating disappointments with the hostility of the broader society. Minority members must constantly shift between the home culture and the dominant culture to choose acceptable behavior in each situation. The dual perspective allows the practitioner to attempt to understand the structural barriers that those in other groups experience. This perspective makes the practitioner aware of the day-to-day challenges minority clients face. And of course, if you don't recognize that, then you are probably being not doing a very good job of being a counselor. You need to understand that minorities do have a potential strike against them depending on the environment, of course. Sorry, I needed a drink. Oh, that's it. Oh, there he is. McLovin. Okay. Now, let's go to chapter 3, Values, Ethics, and Legal Obligations. Why in the world do I have dancers? We'll find out in just a moment. Values are preferred conceptions of people, outcomes for people, ways of dealing with people, values. Personal values influence your view of the world, your personal and professional philosophies and choices, your view of how people change. Professional values often include principles of respect, self-determination, social justice, professional integrity. Areas where personal values may conflict with professional values include religion, health, marriage and family, education, the role of the government, birth and death, and honesty. Ethics codes provide a brief explanation of what can be expected in the interactions between professionals and clients, as well as between professionals and other professionals. Ethical codes contain statements about what the professionals must and must not do. And one of the things they must not do is run things past the ethics department so they don't see it. That's a joke. Helping profession organizations, the American Association of Marriage and Family Therapy. So if you want to be a marriage and family therapist, there is the organization webpage. American Counseling Association, American Psychiatric Nurses Association, American Psychological Association. I am a member of the APA. Association of Addictive Professions, International Association of Marriage and Family Counselors, which isn't the same as the American Association of Marriage and Family Therapy. Okay. National Association of Social Workers, National Organization of Human Services. There you go. So there's all the websites. If you want to become a member of one of those groups, you probably need to check out their website. Professional competence includes practicing within the scope of competence based on education, training, professional credentials, and professional experience. One of the most important aspects of professional competence requiring professional self-awareness is cultural competence. Cultural competence is defined as the application of cultural knowledge about individuals and groups of people to the standards, policies, attitudes, and practices of the helping process to result in better outcomes. Confidentiality is vital for information shared by the client with the therapist in the course of treatment. This information is not to be shared with others. Without confidentiality, clients are less likely to disclose sensitive information with the practitioner. Why maintain confidentiality? The potential for clients to experience stigma, the moral obligation for helping professionals to follow the ethical standards for a professional, model of acting with discretion and keeping one's word, and of course, it's legally required. With the expansion of technology into all aspects of our lives, communication has become more and more difficult to regulate. Cell phones, fax machines, answering machines, computers, internet sites, all of this may have confidential material on it that can be seen by someone who shouldn't be seeing it. Limit sending confidential material on insecure lines, like fax machines, where anybody can answer the fax machine or punch the button on the answering machine and hear what you have to say. Boundaries are defined as borders that separate some types of entities, for example, parents, children, systems, clients, service providers, and healthcare workers. In all helping relationships, maintaining appropriate boundaries is an essential part of developing a trusting relationship with a client. Relationship boundaries must be maintained with delicacy. Sexual relationships with clients are forbidden by all professional codes and represent the most common ethical complaints against helping professionals. In one study, 7 to 8% of the practitioners reported engaging in sexual intimacy with a client. 7 to 8%. That means one out of every 11 counselors has had a sexual relationship with one of their clients. Sexual relationships can have a seriously negative effect on the client. Cognitive dysfunction, identity and boundary disturbance, sexual confusion, rage and feelings of guilt, depression, and emptiness, self-destructive feelings, increased risk of suicide. I was counseling a young lady once upon a time, and it was kind of an interesting situation. I didn't really feel comfortable counseling her. I thought that she needed a female counselor, but there was nobody available at the time. So I started counseling the young lady, and her idea was that if she acted seductively, then she wouldn't really have to deal with her problems. So she started acting seductively, and at that point, I shut everything down, and I said, "You need to go and see a female counselor." Um, and she said, "But I've never had a problem like this before." In other words, what she was doing, she was using her seductive capabilities to stop the counseling process. And that's what she was used to doing. She was used to controlling the situation with her sexuality. And of course, I was able to pass her off to a female, something that she didn't want, mainly because she couldn't manipulate the situation with her sexuality. And as it turned out, she had seen two or three different counselors. This had always worked with the male counselors. If she had a choice, she would pick the male counselor because she wanted to dominate the situation. She didn't really want to deal with the problem. But once we got her into counseling with a female counselor, things actually worked out far much better for the individual because she was able to find um, uh, to actually deal with her problems, and that's what she needed to do. So, this is not a good situation, any sexual situation, despite the fact that you get to learn intimate details about your clients. Sometimes it's not a very good idea. I've had a number of female clients with no problems whatsoever. But of course, she was one of those individuals that needed to control the situation, and that was not going to work. And it shouldn't have worked with the two previous male counselors that she was able to manipulate. Touch, accepting gifts, and self-disclosure by professionals are behaviors that have the potential to be boundary violations, depending on the circumstance. More damage can be done by overstepping boundaries than the help previously given. There is a difference between city ethics and rural, small-town, reservation boundary ethics. It is easy for a city practitioner to gravitate in different circles than their clients. In smaller communities, it can be nearly impossible. When I was living in Montana, there was one counselor in the entire county. The county was the size of Delaware. It was pretty big. There were 7,500 people in the county, and there was one counselor. So it was impossible. There was only two towns. There were two towns in the city. So it was impossible for the counselor to live someplace else and work in that county. So she lived in the county, and she lived about a half mile down the road from me. I didn't need counseling, but the individual that she married was one of her clients, and of course, in a different situation that wouldn't have been acceptable. But in her case, because of the small town ethics, the small town situation, the boundary violations are much different. The desire to help the people in the community that you were raised in is strong. When you know the client before trying to help them, you are maintaining a dual relationship, and you should try to avoid this. Be aware that if you take on this task, you are possibly in ethical violation. Never, ever counsel a relative. You can't do it. So I would imagine if you are aware of the people in your clan, that these individuals you need to stay away from. Other people that you need to stay away from are people that you went to high school with, or people that you went to school with. Now, they didn't have to be in your class. If you didn't know them, no big deal. If you didn't know each other, no one cares. But the problem is that if you knew somebody before you grew up, then maybe your ideas of that individual are still stuck in there, and they are immature ideas of that individual. So you may be interpreting things incorrectly. And that's one of the reasons why you need to stay away from these boundary violations. Another challenge during your professional relationship is how much information about yourself you should disclose to the client. Self-disclosure should only be used in the best interest of the client, certainly not the practitioner. And that's some clients some counselors use their clients for their own counseling needs. So they tell them things that they probably shouldn't be telling them, just so that they can, get it off their chest. Not a good idea. That's not what's supposed to be happening. After the dance is over, after the professional relationship is over, all ethical code strictures are removed. But the practitioner needs to be careful about how much contact they have with an old client to avoid damage due to confusion. The power differential remains. Seeing you out of the professional context may disclose vulnerabilities. It will be difficult to accept this client professionally in the future if you see them socially after they have left counseling. So if you ever want to counsel this individual again, you need to stay away from them. And that's where that picture comes from, after the dance. Most codes of ethics discuss the following ethical issues related to assessing clients. The assessment procedure or instrument should be within your scope of practice, education, and training. Clients should be fully informed about the procedure and be included in the procedure in a collaborative way. Appropriate instruments or procedures should be selected based on the assessment question. Assessment instruments and procedures used should be standardized and include normative data appropriate for culturally diverse or disabled clients. When administrating, scoring, and interpreting, when administering, scoring, and interpreting instruments, appropriate procedures should be adhered to. That should be administering, not administrating. Clients should be given a clear and complete explanation of the assessment results. All test and interview data should be kept secure and released only to individuals who are competent in interpreting the data. And of course, this is a problem we run into in medicine all the time. We give you the results of your lab tests, and of course, you have no clue what's normal and what's not normal. Sometimes we will give you the norms. But one of the things that doctors really need to do is explain why they gave you the test and what they were looking for. Informed consent means full disclosure of the purposes, goals, techniques, and procedure rules for assessment and counseling approaches used in language that is understandable to the client. Legal violations are distinct from ethical violations. Ethical challenges are generally brought before a state licensing board, but can originate from a professional organization. Legal obligations to clients include duty to care, duty to respect privacy, duty to maintain confidentiality, duty to inform, duty to report, duty to warn. Legal limits to confidentiality. Confidentiality is not absolute. Laws vary by state. It is important to keep up to date in your own state laws concerning confidentiality requirements and expectations. Malpractice is defined as negligence in which a professional fails to follow generally accepted standards of the profession, resulting in injury to the client. The client must prove 4 things about the practitioner to recover damages. The practitioner owed the client a duty to conform to a particular standard of conduct. The practitioner had an obligation to follow defined standards of care. The practitioner breached that duty by some act of omission or commission in the professional practice. The client or others suffered measurable damage or injury. The practitioner's conduct was the direct or proximate cause of the damage. The top 5 reasons for malpractice of practitioners in the United States are incorrect treatment, sexual impropriety is number 2, breach of confidence is number 3, failure to diagnose, incorrect diagnosis, suicide of the patient. This is actually a counselor in Belfast, Maine, wherever that is. And if a practitioner loses in court, there may be several consequences. They might be fined for damages punitively. If you were following the case of Alex Jones, he lost the first case, the criminal case he lost, I guess he didn't actually lose. Yeah, he did. He lost it, and he had to pay $4 million. And he was thinking, oh man, I got off easy. Only $4 million. I said some really stupid things to about the Sandy Hook situation, and it only cost me $4 million. Then they had the punitive trial where they decided how much he should be punished, and that's what punitive means. It means punishment. And in the punitive trial, he had to pay $48 million. So he got off fairly well with the civil trial, but his punitive trial, he got his butt kicked. They might be fined for damages, punitive damages, and in his case, of course, it was $48 million. Or they may have to pay for further counseling. The loss of licensure is a possibility. The loss of reputation, certainly. Future difficulties in obtaining malpractice insurance. The court case, whether won or lost, might damage the practitioner financially, emotionally, or professionally. And I would say this guy has been damaged at least professionally, financially, emotionally. Adhere to up-to-date practice methods, good documentation of practices. Oh, this is how you minimize risk of ethical or legal challenges. Adhere to up-to-date practice methods, good documentation of practices, maintenance of appropriate boundaries with your clients, no multiple relationships. Be careful. The following activities may lead to malpractice: a sexual relationship with a client, practicing beyond your scope of competency, fraudulent billing, violation of reporting laws, breach of confidentiality, or refusal to provide records. And of course, all of these are really serious problems and the main reasons for people being charged with malpractice. Ethical dilemmas involve making a choice between two or more relevant but contradictory ethical directives where every alternative results in some type of undesirable outcome for one or more persons. It's the damned if you do, no matter which one you pick. Reamer in 1995 describes two principles that can guide practitioners in resolving ethical dilemmas. Beneficence, where the practitioners should take action intended to help or benefit others, and now non-malfeasance, where the practitioner should act without malice in order to do no harm. Elaine Congress, a social worker, came up with the ethic model. It's a model of decision making in the year 2000. Examine all the relevant client, personal, agency, professional, and societal values, including personal, societal, cultural, agency, client, and professional values. That's the E. The T, think about ethical standards of your professional code of ethics and relevant laws. The H, hypothesize about all the possible consequences of different decisions. I, identify all who might benefit and all who might be harmed. It is often necessary to research potential consequences of possible decisions on all those involved. And C, consult with supervisors and colleagues as you begin to formulate choices. When a supervisor, colleague, or consultant is involved, the final decision must take their thoughts into consideration. And that's the end of the lecture for this week. So you have two chapters that you're dealing with. You have McLovin's chapter and the Dancers chapter. There we go. So I'll talk to you next week.